This video is about treatments for prostate cancer in the bones. This video is the third of 5 short videos on bones and advanced prostate cancer. I'm not a doctor. I'm just a man with locally advanced, recurrent prostate cancer. I ask the questions. An expert medical oncologist answers the questions. And when you occasionally hear this sound, our resident artist attempts to illustrate. Meet the doctor.
My name is Alicia Morgans, and I'm an assistant professor of medicine at Vanderbilt University in Nashville, Tennessee, in the United States.
If a particular spot of prostate cancer in the bone is threatening a possible break, or pressing on the spine, or causing pain, how can we treat that?
The particular area in the bones is affected by prostate cancer. We can treat that area if it's painful with radiation, or if it's weak. We can also use radiation to strengthen that area. Radiation can be a great tool to both reduce pain in the bones and also to strengthen areas that might be weakened by the cancer. Sometimes when prostate cancer is growing in the spine, we can use surgery to stabilize the area as well. That can also help relieve that cord compression problem that men can develop where the cancer is pushing on the nerves in the backbone. The stabilization that surgery can provide can reverse paralysis in the best cases and can help men recover from the pain and from the problems that can happen because prostate cancer is growing in the bones in the back.
What is the best way to avoid prostate cancer in the bones?
The best way to avoid problems with prostate cancer in the bones is to treat the prostate cancer and to keep it under control.
Have I asked the wrong question by saying avoid?
The thing that bothers me about that question is that men don't always have control. So you can treat your cancer as much as you want, and for some men that will keep the cancer out of their spine. But it's not a failing of that person. If the cancer starts to grow in his spine, it doesn't mean that he did anything wrong. So what I don't want to imply is that there are so many things that you can do to keep the cancer out of your bones, and it only goes to your bones if you fail. That's what I'm trying to avoid.
What else can we do to keep the bones thick and strong?
The other thing that you can do to keep your bones thick and strong is to use treatments to strengthen the bones.
Once prostate cancer is growing in the bones, or the bones are thinning because of treatment, are there any drugs which help?
There are certain drugs that we could use to strengthen bones and prevent them from breaking if cancer has started growing in them and if they've become thin because of the treatments that we use for prostate cancer. The drugs that are the most effective are Zometa, which is a bisphosphonate, and denosumab, another medicine that can work to rebuild bone if it has become thin.
A man has pain from metastases that are too widespread for spot treatment. Is there another radiation option?
If a man has pain in his bones from metastases or spread of prostate cancer into different bones, and he cannot use something like external beam radiation to just spot weld or to treat a specific area because the pain is in multiple places, we can use things like Xofigo or radium to treat the whole skeleton in any area where the prostate cancer might be growing in the bones.
How does Xofigo, radium-223, work?
This is a great tool for us because the Xofigo goes in through the blood and travels through the bloodstream to any area where prostate cancer is growing in the bones. And in any of those areas, it can provide radiation that can relieve that individual's pain.
At what stage of treatment can Xofigo, radium-223, be used?
Xofigo can actually be used at any point during the treatment of advanced prostate cancer if a man has metastatic prostate cancer in his bones.
Why might Xofigo be used early in treatment?
We can use it early on if a man has a lot of pain in multiple bones for pain relief.
Why might Xofigo be used later in treatment?
And we can use it later after we've used things like chemotherapy, because radium or Xofigo actually helps men to live longer. So we can use it at any point. We often will use it for pain control if we're doing it earlier, and we use it as a treatment later if we've already used chemotherapies as another option to help men live longer.
Does Xofigo have side effects?
Xofigo can also have side effects like any treatment for prostate cancer. I would say the most common is a little bit of fatigue, and that can be caused both by the medicine itself and also because Xofigo can cause the blood counts to go down, something called anemia, when the red blood cells go down. When you have low red blood cells, that can also make you tired, which is that symptom that I referred to. Sometimes a symptom might be a flare of pain in the days just after a man gets Xofigo, and that can be in any area where there's prostate cancer growing in the bones, but that usually resolves or goes away within a couple of days. Xofigo can also cause a little bit of stomach upset, and that can be a little bit troubling, but also usually goes away within a couple of days.
Do these side effects affect many men?
Most men taking Xofigo have very few side effects, and in that way it's a very useful and helpful medication that can relieve pain and help people live longer, but usually doesn't come with a boatload of side effects.
Thank you.
Thank you.
This video is the third of 5 short videos on bones and advanced prostate cancer. Look for the other 4 videos which deal with why bones are important in advanced prostate cancer, the special case of prostate cancer in the spine, hormone therapy and bones, and a special message on pain. If you want to see more videos on advanced prostate cancer in the future, click on subscribe. If you like this video, please give it a thumbs up. It helps. Think anyone else might like this? Share it by email, Facebook, Instagram, Twitter, whatever. There are links to more resources in the description below. Comments or suggestions are welcome below. Thanks for watching.